Some of you may be wondering, how does COVID-19 affect Ramadan for you this year? Does it change your decision to fast? Many of you with specific health conditions may face this dilemma every year. Some may still fast against the advice of your doctor and scholars. But as much as we all want to gain the rewards of this beautiful blessed month, we must remember that fasting is not obligated for us all. We must remember that our body is an amanah and has rights over us. At the time of a pandemic, you becoming unwell has greater consequences for you than before. Your diabetes, asthma, blood pressure going out of control doesn't just affect you. It affects your doctor, your nurse, your pharmacist, your hospital, who are all stretched right now trying to save lives from the pandemic. If you were to become unwell, this would also add to the pressures and risk your health unnecessarily. That is why it is important to discuss the best action plan for you with your doctor, even if it includes non-fasting. Telephone consultations are available, and it is important you don't risk your own health or a hospital admission in the current pandemic.
For those of you who have no underlying healthcare conditions and are otherwise fit and well, but are concerned that fasting could increase the chance of getting COVID-19, do not worry. Although current research is limited into the effects of fasting on immunity, but the current data does not suggest there is any cause for concern. Well, individuals with no underlying medical problems and who are currently fit and well, and who are adequately hydrated, nourished and rested are capable of fasting in the month of Ramadan without any increased risks.
As for those who are frontline healthcare professionals concerned about PPE leading to dehydration, it must be an individual choice whether you fast or not. There is a difference of opinion on whether it is acceptable to delay your fasts to a later date. Some scholars advise you should fast, and if you encounter difficulty, it is permissible for you to break the fast and repeat it at a later date. Whereas, other scholars have stated you may immediately postpone to a later date. Look at people.nhs.uk for tips regarding key workplace considerations for those on the front line this Ramadan.
We pray you all have a beautiful Ramadan full of blessings, and remember to stay safe and be kind to yourself and others.